So in recent news, S1486, which is the Long-Term Care Hospital Improvement Act of 2011, is a hot topic with occupational therapists nowadays. So the act supports the long-term care hospitals that must validate within 24 hours if a patient meets the admission criteria. A patient cannot be admitted to long-term hospitals unless they fit the certain patient requirements. The criterion includes pre-admission patient screening followed by a physician evaluation. Additionally, certain discharge criteria must be followed before patients are sent home. Now, let's take it over to Jennifer, who's going to interview some OTs on this topic.
My name is Jen. I'm reporting from the Bay Path Hospital. I'm sitting here with Heather. She's a current patient at the Bay Path Hospital. A few weeks ago, she just suffered from a C8 incomplete spinal cord injury. Heather, can you tell me if you feel like you're ready to be sent home?
This is ridiculous. I'm definitely not ready to be sent home. I don't even have a wheelchair ramp to get into my house.
Wow. Can you tell me some of your concerns with being sent home?
How am I gonna get in my house?
Okay, well, we're gonna come up with a few options to try and, not have you sent home so quickly. My name is Jen. I'm reporting live from Bay Path Hospital. I have Dawn here on my left, who just had a hip replacement a few days ago. And I also have Shannon here on my left, who is her occupational therapist currently. Unfortunately, insurance won't cover Dawn to be here at the hospital anymore, and she's being sent home in a few days. Can you tell me about her current progress in OT?
Well, she's not yet ready to go home. She still has a lot of trouble getting in and out of bed by herself. Her house isn't set up at all for her to go home. And I have to abide by the OT code of ethics, and she needs longer treatment, but unfortunately her insurance isn't covering.
All right, can you tell me how you feel about this, Dawn?
I'm so at a loss. I'm in so much pain. I can't bear weight through my leg. I don't even know how I'm gonna get around my house. I don't even know if the walker is gonna fit through the doorways or anything. I'm not ready to go home.
All right, well, thank you guys so much for allowing me to interview you. We're gonna try and come up with the best plan possible. Hi, my name is Jen. I'm reporting again from Bay Path Hospital. I'm sitting here with my fellow occupational therapists who are currently on their lunch break, so I'm gonna try not to keep them too long. But can you guys first tell me your names?
Rochelle? Julia?
I'm Mike.
All right, thank you. Could you guys tell me a little bit about this pending 1486 Act and how you feel about it?
So there are a lot of benefits to the pending S1486 Act. So for example, this pending act helps patients get the proper treatment that they need to progress, because hospitals will not be able to accept every patient due to pre-admission criteria. In addition, a common problem is that patients are being sent home because insurance won't cover enough treatment sessions. Meanwhile, patients are not in the right condition to be sent home. So this act can ensure that patients are being sent home when they are ready physically and mentally to be discharged.
All right, thank you, Rochelle. Julia, can you tell me how you feel about this act?
Well, I'm in full support of this act. I've seen a lot of patients who were discharged before they're ready, and what happens is they go home and their house isn't properly set up for them, or they haven't finished going through rehab, so they end up back in the hospital again. So it's a vicious cycle.
All right, thank you, Julia. I appreciate that. Mike, can you tell me what you feel about this act?
Yeah, I mean, I agree with them as well. I'm in support of it. As they said, they kind of hit all the topics. They said, like, it's a big cycle. If they go home and their house isn't ready, they're going to fall again and get hurt and just be right back where they started. And so it's really important to make sure that they're mentally and physically prepared to make it to go home, and so they're most efficient.
All right. I just want to thank you guys so much for taking your time at your lunch break to interview, so I can interview you guys. Thank you again.
Thank you, Jen, for that wonderful report. I can see how S1486 will make a big impact in patients' lives, and also thinking about all the documentation that the therapists go through, and it still does not make an impact on the patient's stay. Well, that's all for S148. Now for sports.